I am Shanmugapriya, working as a lecturer in SNS College of Allied Health Science. Today we are going to see about spinal anesthesia. So, spinal anesthesia is neuraxial anesthesia or regional anesthesia in which local anesthetic is placed directly in subarachnoid space. Injecting small amount of local anesthetic into CSF at the level below L2 where the spinal cord ends. Anesthesia of lower body part below the umbilicus is achieved. It is also known as subarachnoid block or intrathecal block. It produces sympathetic block, sensory analgesia, and motor block. The picture shows the structures that are encountered during spinal anesthesia, which includes skin, subcutaneous fat, supraspinous ligament, intraspinous ligament, and ligamentum flavum. Then comes the dura and arachnoid quada equina. Indications of spinal anesthesia includes the surgery involving lower half of the body, that is upper abdomen, lower abdomen, perineum and lower extremity. Obstetrics includes vaginal delivery or cesarean section. Another indication of spinal anesthesia is painful diagnostic and therapeutic procedures below diaphragm. Procedure usually given in lateral or sitting position with body inflection position, that is fetal position. Approach may be midline, lateral or lumbosacral. This is called as Taylor approach. After cleaning and draping lumbar puncture is done in desired space, that is L3 to L4, and local anesthetic drug is injected after confirming the free flow of CSF. It acts mainly on spinal nerves and dorsal ganglia, but a small concentration can be detected in a substance of spinal cord. Drugs used for spinal anesthesia includes local anesthetics. Example, lignocaine. Concentration used is 5%. The drug used for spinal is hyperbaric due to possibility of transient neurological symptoms and quada equino syndrome. Lignocaine is rarely used in current day practice. Bupivacaine. The concentration used is 0.5%. It is made hyperbaric by addition of 8% dextrose. Ropivacaine and levobupivacaine. Less potency duration, quality of motor block is less. Chloroprocaine. Preservative-free preparation of chloroprocaine for short duration procedures. The next one is opioids. A small dose of fentanyl, that is 20 to 25 mcg, is usually added as a supplement to the local anesthetic. Preservative-free morphine can provide analgesia for up to 24 hours with risk of delayed respiratory depression. The next comes alpha-2 agonist, which includes clonidine and dexmedetomidine. It prolongs the action of spinal block. Then comes vasoconstrictors, which includes epinephrine and phenylephrine. It can compromise the vascular supply of spinal cord. Then neostigmine, which prolongs the analgesic effect of spinal. Other drugs includes midazolam, ketamine, tramadol and NSAIDs. Spinal needles are of two types. One is dura cutting and another one is dura splitting. Dura cutting includes which is cutting tip needles. It includes Quincke, Babcock, Greene, Pitkin. It causes more damage to dural fibers. The incidence of post-spinal headache is high. Cost-wise, it is cheaper. Dura separating. Pencil tip point needles, Whitaker and Sporty. It causes less damage to dural fibers. The incidence of post-spinal headache is less. Cost-wise, it is expensive. Factors affecting the height of block includes dosage of drug, baricity, position of patient, site of injection, CSF volume, age and pregnancy. The factors affecting the duration of block includes dose, increased concentration, pharmacological profile of the drug like protein binding, metabolism, added vasoconstrictors. Complications. Intraoperative complications includes hypotension, bradycardia, dyspnea, high spinal or total spinal, respiratory paralysis, nausea and vomiting, difficulty in phonation, shivering, restlessness, local anesthetic toxicity, local anesthetic anaphylaxis, broken needle, pain during injection, bloody tap. Then we have post-operative complications, which includes urinary retention, pruritus, backache, neurological complications, which includes post-spinal headache, paralysis of cranial nerves, anterior spinal artery syndrome, transient neurological syndrome, quad equina syndrome, intracranial complications, paraplegia, neuropathies, and meningitis. Thank you.